Hello everyone, welcome to this episode of Ask Dr. Ada. In this episode, I'm going to show you what I have packed so far in my hospital bag. Actually, I think I'm done packing because I'm very close. I'm pretty much at my due date, and so I'm ready to go whenever baby starts behaving like she wants to come, because right now nothing is happening. But anyway, so I'm going to show you the things I've packed in my bag so far. Right now I don't have a simple bag. I have a what you would call like a little bit of a carry-on suitcase. So I have that, and it has two compartments. One's going to be for my things, and then the other compartment is going to be for the baby's things. So I'm going to show you the things that are on my side first, and then I'll show you the things that are on baby's side. And I'll try to explain to you why these things are important, because depending on if you have a vaginal delivery or a C-section, you may stay longer in the hospital. So here in America, when you have a vaginal delivery, typically moms stay 2 days or under, and then when you have a C-section, you can stay up to 4 days, but usually 3 days if everything goes without complications. Okay, so on my side, I'm going to first show you, I did pack some nursing bras. So it's very important, this is very cute, this is like one of my favorite colors. It's very important that the nursing bras you pack don't have any underwire. Okay, I can't remember. Oh, I got these nursing bras from Motherhood. I got them one size letter up because my breast grew, but generally my width was pretty fine. So I got them one size letter up, and they don't have an underwire. So the reason why you don't want an underwire if you're going to nurse is because the wires can actually press on some of the glands that help you make breast milk, okay? And even though your breast milk doesn't come in on the first day when you deliver, you definitely want to have something that's not going to prevent the breast milk from coming in a couple of days when it eventually comes in. So this is kind of what the nursing bra looks like. And then it has a little clip here, which is important because the goal of a nursing bra is when you want to nurse, you take this off, you can nurse, and then you clip it back. Okay, so I packed two of these, one in a coral color and then one in a black color. The other things I packed, the weather is getting pretty nice now, but I still packed some comfortable socks because sometimes in the hospital it gets pretty cold. And then I packed a pair of just normal socks. Okay, and then I have my underwear. I packed like bigger size underwear, but usually in the hospital they give you like massive underwear, like mesh like underwear with very massive maxi pads. Some hospitals do, some hospitals don't. So you want to either when you go on your hospital tour or when you talk to your midwife or your OB, ask what they're going to provide for you in terms of underwear or maxi pads or things like that. I've also packed nightgowns. So this one has these are just pajamas with trousers or pants, which I may wear maybe closer to when I have to leave. And then I also packed a nightgown that has an opening, has buttons so I can easily breastfeed. What else do I have here? I have, very importantly, I think it's important to get a robe. I got this robe. I don't know, I didn't get it from anywhere, expensive or whatnot, but I just wanted something that kind of has a good airy fabric to it and has a nice tie and was a pretty color that hopefully I wouldn't be too damaged, from blood and all that afterwards, so I can take home and keep and remember. I also packed abdominal binder or a girdle. So when you have your baby, you won't go back immediately to how little your stomach was. To be honest, my stomach was never like flat, but to help, you know, to help my uterus kind of contract and go back down to how small it was, which, interesting fun fact, your uterus when you're not pregnant at all is probably this small, but right now, I showed you my belly in the first episode, it gets really, really big. So things that kind of help you bring your uterus back to normal, it takes a while, you know, it takes some months to kind of get back to a very tiny uterus, but breastfeeding actually is very good to shrink the uterus, and then also just kind of putting your belly back together in a binder kind of helps you contain things. So that's why I got this, and I got this off Amazon, and it just had very good reviews, so I thought it would be nice. I packed a couple of clothes to stay in the hospital with, like when visitors are there. And then they're probably going to give you towels in the hospital, but I packed my own towel, and I tried to get a dark color just in case with like blood and other discharge. These are nursing pads. I'll show you the container they came in, but it's good to have. When you start breastfeeding the first few days, your milk isn't going to be leaking or gushing out, but just in case, you know, you're having some spills of colostrum so you don't stain your clothes, you can put these in the nursing bras, and I will show you what one looks like. For you guys, I will sacrifice one. So this is what it looks like, and this is how it opens up. It opens up like that, and it opens up like that, and then it has two little stickers here and here, and you just stick these parts onto your bra, and then this stays here on your breast so you don't have spills. I mean, it's not anything too specific, you know, toiletry. If you're going on a trip or something, you pack all the same toiletry. So I have my sponge, I have my toothpaste. I just went to a store. You can go to any store and just get travel size of these things just to make things easier. And I have toothbrush and some body wash, all travel sizes, deodorant, and soap. Alright, so that's basically the things that I'm taking right now. Alright, so now I'm going to show you the things I packed for baby girl. So what we're going to do is, I'm going to first of all start with her toiletries, and then I will show you her clothes. I really like Aveeno baby products. This one is actually my own lotion, so this is mine. But I really like Aveeno baby products. They have no fragrance, they have no additives, they have no scent. I'm not being sponsored by Aveeno. I tell all my moms in the clinic, but some babies do react to Johnson & Johnson products. It's very important that you know. And some Johnson & Johnson products smell wonderful, but some baby skin are pretty sensitive and they react to that. So if you find that your child is having your newborn is having any issue with Johnson & Johnson in the beginning, or if you don't even want to deal with that at all, just get a Aveeno baby product. So this is a little lotion that I have for her, and then I also have the body wash and shampoo. Very important when you have a little one that's new, especially when they get sometimes a little bit past their due date. Their nails are very long. Their nails are long, but they're not hard. They're very malleable and soft. So some people recommend you bite the nails off. I don't recommend that, because if you bite the nail off, you'll get to the edge and you may accidentally bite off too much and the baby may bleed. So I just recommend that you get a baby nail file and file it down. Nail clippers, people use clippers too, but those can be also a little bit of a danger because babies are very squirmish and they can easily move and you can cut their skin. In addition to having the long nails, I tend to encourage parents to usually pack like a pair of mittens. I pack 2 packs of mittens. I don't know, just in case which one is cuter depending on what she's wearing. I also went ahead to pack a little washcloth for her. As you can see, lots of things for her and in her room are elephant themed. Just a little soft washcloth for her. Okay, and then I'm not quite sure what she's going to weigh, but a few weeks ago I had to go check her weight, and well, a week and a half ago I had to check her weight and she was already over 7 pounds, so she may not be a very tiny baby, but I did pack onesies. This is actually a size 6 to 9 month, and then I also packed onesies that are newborn and, you know, closer to 3 months. So this one is really tiny. I mean, she may be this tiny, I don't know, but I still packed it just in case. So I packed two different sizes just in case. I also packed, because I plan to breastfeed, I didn't really pack a lot of bibs. I packed more of burp cloths. These are the ones you can just put over your shoulder and burp the baby, or you can put on your lap, you know, and if you're gonna burp the baby while sitting up. So I packed some of these. Don't forget the hats for them, just in case it gets cold. And then just some other clothes, you know, some other dress up clothes that she can have over her onesies. So that's basically what I packed for her so far. When you go to the hospital, there are going to be some procedures that they are, you know, they're not mandatory, but I would say as a pediatrician you should think highly about doing them. One of them is you're going to get a vaccine called the hepatitis B vaccine. That vaccine prevents hepatitis. Now, what is hepatitis? It is a liver infection, and it can be passed on to newborns who are immature and who have not, and if they're exposed. A lot of older people can have hepatitis without knowing, and it's a blood-borne infection. So we try to prevent any transmission of hepatitis to the newborn by giving them their very first dose in the hospital. And that's typically the only vaccine a baby gets in the hospital. So when they go back home and they're exposed to other people, other adults who may or may not know if they have hepatitis, they don't, you know, like when you're making the baby's food and things like that, so they don't get into any contact with hepatitis through blood-borne products or anything like that. So that's one. Babies also get an eye ointment in their eye. It's called erythromycin. That eye ointment is usually done like right when they're born, or like at least in the first 24 hours, and that prevents lots of different eye infections, including chlamydia, which can be passed on to the baby if you have a vaginal birth. Sometimes you may not even know you have the chlamydia, like a few weeks later the child may have chlamydia in their eye. So we put that to kind of prevent any infection that can kind of come on in a few weeks. Another thing that kind of happens to children, they get a shot of vitamin K. Now, vitamin K is not a vaccine. It's a vitamin that we all have, but we kind of give babies an extra boost because it helps to control bleeding. Small percentage of babies that may be missing a component, that may be missing something in their body that makes it so when they're born they can actually have brain bleed or bleed in any other organ. So by giving them an extra boost of vitamin K, their body prepares for any kind of bleed, and it doesn't kind of cause a bigger bleed. And then of course for baby boys, circumcision is up to you. If you want it or not. Lots of people get it. There is a slightly higher risk for boys who are not circumcised to have urinary tract infections. It's always easier to circumcise them while they're still in the hospital because they're still very young, and as they get older it's a more complicated surgery. If a baby boy is circumcised in the hospital, it can be done by a pediatrician, it can be done by an OBGYN, which is an obstetrics or gynecology doctor. It can also be done by a surgeon, and when they do it, they do provide some form of pain relief for the baby. But the older they get, if you do it when they're out of the hospital, they can still do it in any of those clinics that I just mentioned that do them. But the older the boy gets, if you want to do a circumcision, then you have to go to the operating room, put the child to sleep, and it's a more complex procedure. So think about circumcision. If you want to do it, better to do it early. If you don't, that's up to you. Alright, it was nice to have you guys with me today. Let me know if you have any questions or concerns as always, and please like, subscribe, and follow. Thank you. Bye.